you so much for joining me today. I'm Marina Kuperman. Today I'd like to discuss the topic of contraception. A lot of women look for contraception for both purposes of not getting pregnant, but also contraceptives can be used to regulate some issue that a woman has with her menstrual cycle. So I'd like to talk about some different variations of contraception. Again, contraception, or just like birth control pills, the IUD, the Nexplanon, the contraceptive ring, patch, there are a bunch of different alternatives. And not only are they used for purposes of not getting pregnant, but also contraceptives are commonly used for issues related to your period. Contraceptives are a great way to manage painful periods, heavy periods, irregular periods, and provide you with the aspect of contraception. So I'd like to talk a little bit about the different forms of contraception. One of the forms of contraceptives that I use quite oftenly in my office is the IUD. And women tend to be unfamiliar with the IUD. Usually they have questions. What does it do? How does it work? How long does it stay in? Is it painful to insert? Is it painful to remove? And so on. So I wanted to touch on a couple of those frequently asked questions when it comes to IUDs and different forms of contraception. So there are two types of IUDs. There are hormonal IUDs and there are non-hormonal IUDs. With the non-hormonal IUD, it's usually good for, you can keep it in for about 10 years, and it is a barrier contraceptive. The ancient Egyptians used to use rocks instead of the IUD, believe it or not. But today we have a device that does not contain hormones that gets placed inside the uterus. It's a simple procedure, it's a simple in-office procedure, and you just experience a couple of menstrual cramps during the process. The procedure typically lasts less than a minute, and it's a barrier contraceptive. So it's a device that's placed in the uterus and it prevents the sperm and the egg from meeting. Sometimes with the non-hormonal IUD, you may get a little bit heavier and a little bit more painful periods than what you're used to. The hormonal IUD is the same concept. It's also a device that gets placed into the uterus, but it contains hormones. And a certain amount, it's pre-packaged, let's say, with a certain amount of hormones that disperse daily throughout the duration of time that you have it. And most of the hormonal IUDs, they last between 3 and 6 years, depending on which one you get, depending on whether you want one that has a higher amount of hormones or a lower amount of hormones. But typically, the lifespan of the hormonal IUD ranges between 3 and 6 years. And what the hormonal IUD does is it not only provides you with the barrier contraceptive aspect, but also helps to control painful periods, irregular periods, heavy periods. If you're someone who has fibroids, a hormonal IUD is a great option. So aside from the IUDs, there are birth control pills. I always say, there's not one perfect birth control pill. If there was one that was perfect, everybody would be on it. So sometimes you have to go between several different types of oral contraceptives before you find the one that sits best with you, gives you the least amount of side effects, and helps you to achieve what you're looking for when you're taking this medication. So typically you take it once a day. You should take it around the same time each day. And oral birth control ranges between different types of hormones, different dosages of hormones. So it's up to your doctor, it's up to you and your doctor to decide which dose is better for you and which combination of hormones is better for you to give you the effect that you're looking for. Aside from the pills, there's also a patch. It's like a little Band-Aid that you change every week. There's the contraceptive ring, that's inserted vaginally, and you change that every 3 weeks. There's an implant device that is placed under the skin. So there are a lot of different forms of birth control. If you're interested in hearing more about the various types of birth control, feel free to contact me at the office or via email. Hope to hear from you soon.